strongly believe that we should try to start on time and finish on time, maybe 5 minutes before. Uh, okay, so welcome to everybody. I'm Dr. Raj Shah. I'm the chairman of Health Council. This is the first meeting of our Health Council for starting year 2022. I have dared to make this a mammoth task meeting, action-packed, with almost 25 speakers going to finish in 80 minutes, so that it will give us 10 minutes for question answer. Now, if you take more time, then there may not be time for question and answer. I truly feel humbled and honored to have all of you come together. This is a galaxy. This is a galaxy of stars, literally visionaries. I won't only call thought leaders, but these are thought and action leaders who have come together, and in very short time, all of you have helped to advance our mission. And I think I want to report the progress we have made. We have some phenomenal speakers. Who would, Chintu, welcome. Phenomenal speakers who will just take 1 or 2 minutes to mention the outline. It's not meant to be a great detail description expected from them. As a housekeeping item, if everybody will keep on mute except one who is talking, and when you do start talking, please remember to unmute and then say a few words as I send you the agenda. Like any meeting that I like to start, I like to start with a prayer. And the prayer is, Om Sahanam Vavatu. May we all be protected. Om Sahanam Vavatu. Sahanau Bhunaktu. May we all be nourished. Sahaviryam Karvavahai. May we all work together with great energy. Tejasvinam Maditamastu. May our intelligence be sharpened. Ma Vidvishavahai. Let there be no animosity. Om Shanti, Shanti, Shanti. Peace, peace, and peace. Thank you. My official welcome to many of you, including, we have 16 board members, 12 physicians, and we have other 25 members. We total a family of 45 official members of the Health Council, and I've invited 10 other guests to watch what we are doing and what is our agenda for the year 2022 and going forward. So with this official welcome, my first brief introduction for all the new members. I will start, the members who are speaking, I will not, I'll introduce them at that time as well. But many of you know, I have Dr. Booch from India, physician, Chintu Patel, a very warm welcome. Chintu is co-founder of Amneal Pharmaceutical. He brings in a amazing perspective of pharmacy and medications. His brother Chintu donated $10 million to Water Foundation, and Chintu, we hope, brings in his passion of medication and providing drug, low-cost drug to villagers. Ashank Desai, our chairman of WJF India, a philanthropist, gave so much money to IIT Bombay and IIM Ahmedabad, and he's our chairman of India Health Council, WGF. Indrajit Chatterjee, I mean, all of these are galaxy. They're all IIT except 12 physicians. As, and they're all stars. Indrajit is on the board member. Dr. Ashok Gupta, I have to say, Padma Shri Ashok Gupta, a very well-known, international known surgeon. Uh, I have Priya Tandon and Nandini Tandon, two sisters on West Coast. Uh, Amazing work in philanthropy, and they are accomplished entrepreneurs. Sushil Bhatia on our board, another IIT grad. He'll be helping our fundraising. Rajat, I think Rajat, you are known to everybody, but Rajat is chairman of Wills Global USA. He's also this year chairman of Penn IIT. He was chairman of Penn IIT when Wills was formed in 2006. Rajat is visionary and a leader and inspire us all. Bindu Kansupada, let me announce, Bindu is a cardiologist, happens to be my nephew, also my partner in cardiology practice for last 30 years, my neighbor, and he has joined not just the Health Council a year ago, but now he's elected to the board, and he will be vice chairman taking the position. So he will continue to help to move us forward. Professor Chalil, physician, a well-known author with Ambassador Kapoor. He will be addressing us. He's a physician, a big name in preventive medicine. I have Amit Kare. Amit ji is our technology partner, a great technocrat. He makes our mission possible, working in India with all the foot soldiers and the support we get in software. Ratan Agarwal is our new member of the board. He is organizing and leading the charge. Ravi Bhatia, Raviji is our guest, but he's not just guest because he's now the charter member of the Australia charter of Wills Global Foundation, a accomplished entrepreneur, very successful in telecommunication industry. And I believe, Raviji, you also started a university in Melbourne.
Yes. Thank you.
Rahul Mehra, Rahulji has joined our Health Council. Rahulji, if I'm correct, you retired from Medtronic, a research medical device, should I say guru. Hitendra Ghosh. Hitendraji is the granddaddy of entire Wills and Penn IIT. He inspires us. Ishan Shivananji, he's the founder of Yoga Immortals. He'll also be talking. Chaitanya, I told about. Dr. Antani, Dr. Milind Antani is a physician, ENT surgeon, but he's a lawyer practicing with Nishit Associates. I thought Nishit Bhai is also going to join, but Milind is there. And when they start talking, I'll tell a few things about them. Suresh Shenoy. Suresh is our president of Wills Global Foundation, USA. Suresh makes the things happen. He makes the wheels rolling. Anilji Bandari, very successful financier, but he has an IIT graduate, philanthropist, and he's also going to address. Nixon Joseph. Nixon is just retired as the president of SBI Foundation. Should I say Maha and a guru in CSR funding, and he will address us. Kalyan Chakravarti. Kalyanji, I'm seeing you after a long time. I'm so happy you joined. He is very successful in programs in particularly Bihar. And then I think if anybody's remained, Varsha Vaidya, Varshaji is professor at Pune Bharatiya Vidyapit Medical College. Yagya Sharma, Yagya makes the technology work. Dr. T.G. Patel, Captain T.G. Patel, retired from Navy. T.G. is my colleague from Baroda Medical College, same alma mater, almost co-timers. And he has done a phenomenal job creating Sevak Foundation. I have Sundar Kamath. Sundar is leading the charge, very successful entrepreneur from West Coast, technocrat, doing amazing work, particularly in nutrition, child nutrition, working with us in Ideal Village program. Pradeep, Ambassador Kapoor, everybody knows you, Pradeep ji, a chairman of the Ideal Village, Smart Village program. Our real connection to the central government of India. Without him, so many things would not be possible. And then we have Kavita Kapoor. Kavita ji is in our healthcare council. She helps us on data analytics and considering that. I have Prakash Kundalia. Prakash is my close personal friend, a philanthropist in Bombay, trustee of Bhaktivedanta Trust Hospital in Juhu. He made one program possible there. Shweta has joined. Rajesh has joined. I think I recognize everybody. Without taking any more time, I'm going to start. If I miss somebody, I'll give opportunity later, but let's get started. Okay. So this is the meeting. WILS stands for Water, Health, Education, Energy, Livelihood, and Sustainability. These are the 6 verticals in which WILS work. Particularly, these are the issues which are for the rural population in particular. And the guiding principle is technology-enabled solution, where WILS act as a catalyst to provide the solution. Today, we are going to be talking about Health Council. This is our meeting. These are all the members of the meeting. I told you we have 45 stars in this committee, and I'm so happy most of you are here attending this meeting, and all of you have done a phenomenal job in helping, giving us vision. Together. We have 16 board members who are part of our health committee, literally who's almost everybody. We have 12 physicians representing 10 different medical schools. And we have all the technocrats and business people and all successful who's who from here and in India. Just a few words about our mission. Our mission is to provide affordable access to healthcare. Access to healthcare, affordable, not free, affordable. And our first step is access. We want to see that rural communities, those who are underserved, those who don't have any healthcare access, we provide that using technology, a cost-effective technology. We call it healthcare easy access for rural community via telemedicine. That acronym becomes heart centers, and heart being very, very dear to my heart, being a cardiologist. Very simple program. We select villager, 1 or 2, we call them Sahayak or telemedicine operator. We give them hardware, which is smartphone with amazing software developed by Evolco, our technology partner. Amit Khare and his team will be addressing us for a minute. We give them this hardware, total cost about $1,000. We train them, we make sure that these are the villager, usually one male and one female. And actually their residence become the heart center. It's in bag, they can take it to patient home, or patient can come to there for evaluation. And they take the history, they take the information. The program is in a native language, different 12 language, so it is very easy. All the symptoms are in simple yes, no format. So you don't need a medical training for these people, and they can just build up a screening or triage, take the vitals, that's what they're taught, and then that part is ready for the doctors at the other end, who can very quickly see that report done and then come online to do a video consult. And if there is no good internet, then at least a telephone consult. So this is the program. This is what we call telemedicine center in the village. We try to go to those areas where there is no facility. We try to stay away in a competition to where there are local providers or clinics or centers. We want to provide service to those who don't have anything. Now, how do you finance this? Our model is very simple. The Wheels Global donate money to buy hardware. It's a one-time cost, anywhere from $500 to $1,000 if we give 2 sets. Telemedicine kit. Operation cost consists of 3 components: physician fee, salary for the Sahayak or telemedicine operator, and technology support, maintenance, and other costs. This comes out to be at cost about $50 or 110 rupees. This cost can be waived for the patient if, for example, a charity hospital or clinic or group of physicians say we will provide free medical service, then patient does not pay this 50 rupees, they only pay 60. If the villager is a volunteer and say, I don't need this money as salary, then this is not paid by them. So it is only 30 rupees. And if some organization, if they're very poor and can't afford, we will provide free service. I'm happy to say that during COVID time, Evolco used their own 200 plus physician, their own telemedicine operators, and provided free service to 13,000 plus patients. So, but we'll start charging to defray this cost. This is our business model. It is sustainable, creates livelihood, provides service, provide the cost, and if patient has to travel and go, it will cost them 4, 5, 10 times more than what they will do it. Plus, another advantage is this Sahayak is a resident of that village. So this service is available to them all the time, and not like a van or somebody just coming once a week or once a month or something. So this is the advantage, and we'll talk about this. To this date, I want to report 315 centers that we created, particularly in last 6 months of 2021. We have provided service to 13,255 patients to this date. All of it during COVID, we provided free service. We will start charging February 1st. We will have the data, and we will be preparing this data according to the acceptable government norm, which is SEHU model, Social Enterprise for Human Upliftment. We'll get all this thing, and we'll be preparing this report. And I think I will let Reina Bandari and Amit Khare, who are preparing this, talk about this. Okay, now let's see. Okay, next I would, this is my brief report, introduction, and brief report to what we did in year 2021. My next, I have invited, there are 3 or 4 or 5 new projects which we have undertaken, which we plan to do in 2021. The most important is starting with Amul Dairy. And I'm delighted to introduce Dr. Sodhi, chairman of Amul Dairy. He's also chairman of All India Dairy Foundation. He already has brought another dairy from Banas Dairy, which is in Banaskantha district. I have to say that Dr. Sodhi got his training from Mr. Bhatt, who was the project manager for the dairy in my hometown, Sagar Dairy, when he started building in 1962, when I had just passed my SSC and left to come to Baroda for my higher education. So Dr. Sodhi, kindly give us your outline of plan that will happen, what we will do, and your take. Dr. Sodhi.
Yeah. Good morning, good evening. Sorry, I'm actually in Guwahati to attend some marriage. So I'm sorry, I have to. I'll be just joining briefly only. Am I audible?
Very well, very well.
Can you hear me?
Yeah, we hear you very well.
So thank you, Dr. Asha. Okay. Thank you, Dr. Asha, for giving this opportunity. Basic some data about Amul. First of all, let me clarify. I'm not the chairman. Amul, I'm just the managing director. And chairman is a farmer, a milk producer. In Amul, we have got elected board and they elect one of the member as a chairman. So it is Shamal Bhai Patel, who is a milk producer. He is the chairman. Okay, about Amul basic data, I can tell you it's a Gujarat based cooperative, 75 years old. And we have got right now 3.6 million farmers across around 18,600 villages of Gujarat. So you can see each and every village, we have got our village cooperative society with all the infrastructure for milk collection, and it's a hub with the on-network connectivity, and where every day we collect milk twice in a day we collect milk, and milk is transported to nearest dairy plant and then processed and add value, and it is marketed under Amul brand name all over India and abroad. And this year our Amul will be around 62,000 crore organization, so around more than $8 or $9 billion. It's the biggest, India's biggest food or FMCG company now. We had that privilege of interacting with Dr. Asha and other members on this telemedicine project, and we definitely liked it, because ultimately objective of Amul is to how to improve the livelihood and the living condition of our milk producers in the Gujarat, who are also the owner of Amul. So, when we saw the details of this very innovative way of taking care of health, so we agreed. So, as far as Gujarat is concerned, like I mentioned, there are around 18,000 villages, and around 10,900 villages have primary healthcare facilities, and then through community health center, around 1,500 primary health centers are there, around 9,000 sub-centers. But I don't know what is the quality of facilities, etc. But there is definitely a scope of telemedicine, especially for the underserviced areas of Gujarat. And because Amul is in all the areas, so naturally we can identify each district, which are the areas where the right now medical services are not available. So right now, as far as our knowledge of this health is concerned, we have got two projects going on in two districts. One is Anand, Kera district, where Amul started. We have got the Tribundas Foundation, which is already more than now 40 years organization, which is working in more than 1,000 villages of Anand or Kera district. And it's one of the largest community health service provider organization, where they carry out program for the mother and child healthcare program, and menstrual hygiene program, and prevention of tobacco addiction program, etc., where we have our workers doing the villages and taking care of all these things. The second very big project we started in Banaskantha district, is the north of Gujarat, bordering Rajasthan, where Banas Days opened up one very modern medical hospital as well as a college. So these are things. So what we have thought of doing pilot with the Global Foundation is we have selected two districts, Kera and Banaskata, where we'll be doing the pilot in the identified villages. And meeting with our team from Banaskata Kera on 24th of January. And we are now ready with our whole planning. What we have desired that to have a very, very safe and very practical planning so it can be executed very well. Our team wishes to visit few of the telemedicine centers which presently Global Foundation is working. So we'll be very happy from contacts details can be given to us so that our team is ready. They can go and see it. And once we start the pilot, and I'm very, very confident that we are going to get a lot of demand from all over Gujarat, and a lot of local and government will also be interested because in Amul, one thing is there, our execution is 100%. Whatever we decide, whatever is we show on the paper, it is 100% executed. So that's why we want to be very sure about execution by seeing how presently it is done and how it can be implemented in Gujarat. So we are ready, and because this is a very noble cause and very practically, it is this we want to do it for our owners, where health services are not available. So we are open to the ideas. We are open to any other innovation you wish to guide us. But we like to see a few of your centers before we go ahead with our detailed planning. Thank you.
Thank you, Sodhiji. I made the arrangement. I talked to your team. I know we have 70,000 villages in the Anand Dairy, as well as there'll be even more, including Banas Dairy. Both teams will be going. I'm making arrangement for them to visit the center in Arwali or in Bombay. But we'll have this done in very short time. Amit ji will and his team. I already written them email. So this will be a huge opportunity for Wills Global Health Council to introduce program and work with Dr. Sodhi to with Amul. Of course, I'll also say that Dr. Sodhi will also be helping the team, Suresh and Rajat Sundarji and Pradeep ji in our Ideal Village conference. He has agreed to participate and help to spread the words and help us in CSR and all other sponsorship program. So thank you. The next project, thank you. And again, he's attending a wedding in Guwahati, but I'm so happy that you joined us, Sodhiji. Enjoy the wedding. Thank you. But please stay on till we finish if you can.
Yeah, thank you.
Thank you. Next I have is Indrajit ji, our board of director, WGF India, brilliant IITian, MITian, and successful entrepreneur on the board of Sobus, Sweri, everywhere. And he'll give us a brief outline of the project we are starting in Pandharpur, Maharashtra. Indrajit ji, you have 2 minutes to tell us about the project, what we're doing.
Yeah.
Unmute your mic, please.
I have unmuted.
Okay, go ahead.
Thank you, Dr. Raj Shah, for the opportunity. It's a great one to meet all audiences and the attendees. All of us are known to each other well otherwise. I'll just take less than 2 minutes. Wheels has actually started smart village, integrated smart village program in two places, Aravalli village in Gujarat and Pandharpur in Maharashtra. I am looking after Pandharpur along with our India President Digvijay Chaudhary, and Digvijay is also the founder of Sobas Insight Forum, and they are our managing partners on ground. And we have selected Sweri College of Engineering located in Pandharpur, and that is also founded by an IIT Bombay alumni, Dr. BP Ronge, and that's an ideal place for starting something. Sobas has started Center of Excellence with the help of Wills and Sweri and other things there. Now, for smart village interventions, many interventions are actually introduced there. I talk about the healthcare part of it. I'm taking care of telemedicine thing along with Dr. Rajsa and Varsaji, Dr. Varsa Vaidya, who is located in Pune. And from wheel side, we two are driving there. And Rajsa has already addressed all the requirements and presented the heart model just now, what he has talked about, to a larger audience in Pandharpur, about 75 people in the pharmacy college as well as all the members of Pandharpur town. They attended the meeting. A lot of people are interested. We have identified through Sweri College, because we don't do any of the ground level work. Tobas is working through Sweri College of Engineering. They have identified 6 villages as per the norms required by Rajsha, and they are actually located within 20 kilometers of Sweri College, and they are under Pandharpur Taluka of 100 villages, and they are having population of 3 to 5,000, and we have also located 7 more centers with 7 villages for 9,000 and above population. Now, our basic work has started yesterday morning India time. Ivolco has very kindly agreed to send their representative there at site, and Vatsaji also attended that one. It was both online as well as in-person meeting at Sweri College. Many people who are interested in the to become telemedicine operators as well as the coordinators for that one, meaning they will be the entrepreneurs also. So they have attended, and they are arranging for the next meeting with Evolco for finalizing that training program to about 20-25 telemedicine operators there. Along with Sweri will be our first model actually, because of its convenient location and the advantage of the funding and infrastructure. They have a hospital of their own there, which is led by Susma Ronge, who is the daughter-in-law of the founder, and Vatsaji, Susmaji, and our Resa Patel, they are driving this one. And with Evolco, this one, we have identified these villages. They will go around along with the Evolco team also to have any further queries answered to them. And we are also planning, by this one will be done in about 3 months time from now, starting from end March, and by March next year we will be starting our, about almost we are planning to slightly bigger ambitious plan of 200 centers. Right now I have at least planned that way. So I'll end that one. This is our time limit also. So that's it. Thanks, Raj sir.
Thank you, Indrajit. See, so we'll add at least 7 to 10 centers in Pandharpur. Before I bring in Smitaji, is Smitaji there? While I wait for Smitaji, I want to introduce Dr. Vikas Khurana. Few faces I did not, I miss. Vikas is the one who actually got me into Wills. He's a gastroenterologist, an entrepreneur, inventor, and a dedicated person with service at heart for India. So Vikasji, thank you. I have Rajesh ji. Welcome, Rajesh ji. I just saw Nishit ji joined us, Nishit Desai, the founder of Nishit Desai Associates, one of the largest law firm in Bombay, and it's everywhere in the world. And he's going to address us in a little bit. So if Smita ji is not there, Smita ji, are you there? No. So I'll just tell you, Magan Sangralaya in Varda, we will be doing a project. They're waiting to hire a physician, and that physician will undertake, we'll start with 10 centers, 10 telemedicine centers. Vibhaji is Smitaji's sister. Smita Siddhanti, she's on our board. She's an entrepreneur, president of Endine company in Washington, D.C. I miss her not being on here, so she can tell more about Magan Sangralaya, but that's the report on that. The next project is on mental health treatment and by yoga and meditation. I'm privileged to have Ishan Shivananji, who is the founder of Yoga Immortal on West Coast. His father, Baba Shivananji, he has a huge followers in India, located in Uttar Pradesh. And I asked him to take 5 minutes to give us a brief introduction, what we'll be doing and how we will be helping villagers to learn meditation and yoga in their practice to help mental health. Ishanji, please, 5 minutes.
Thank you so very much, Dr. Saab. My regards to every single person who's there, and a deep gratitude for all the good work that everyone has been doing. My specialty is bringing integrative healthcare modalities that are non-pharmaceutical in nature, meditation-based, to help with the mental health crisis. So a lot of the times we felt that when it comes to mental health, because it's intangible, and in India, a lot of education needs to be provided for the same, we would have lack of motivation, especially with villagers, if we would tell them that these modalities can really help with your mental health. So one of the projects that we started that really could help children in a beautiful manner is, in the last few months, we created a scholarship fund with which till now we have taken about 60 children under our wing. These are children who have graduated from 12th and who have shown academic expertise in their field. So one of the criteria that we kept in renewing the scholarship, which we renew after every year, is if the child, through these virtual modalities, every single month presents himself to a case manager, and the case manager then uses the tools that have been created to evaluate the child and to provide him some form of meditative mindfulness-based intervention to help with the child's stress release or any psychosomatic ailment that he would be suffering from. And in the past 3 months, we've seen it's been a great success, because now the children are motivated to renew their scholarship, and every single month they come, they take these modalities, and now somehow they are even motivating their families, and they are showing the benefits of mental health peace that can align in a person's worldview. Another challenge that we faced was that when we are giving this meditation-based non-pharmaceutical intervention as aspect of a broader concept of mental health, many times people in India are not able to differentiate between spirituality and meditation-based mental health. So this is where it was very, very impactful to partner with Wheels and partner with Dr. Bindu Kansupada, who was able to help create these modalities in such a manner where they will not be misconceived as any form of spiritual education, but as something that will have a psychosomatic aspect. So we have made a whole array of protocols that can be prescribed to any person on any socioeconomic strata of society. Until now, the results have been phenomenal. We also did a study on athletes in December and January, where 2 months we were working, and these were again children who were competing at a national level. And there is a very interesting statistic that I would like to share with all of you that shows the importance of mental health. So we had two groups, the control group and the research group. So the people that were provided a mental health protocol and intervention, we saw that 75% they had an increment in their quality of life in scales like GAT-7, PHQ-8, etc., etc. There was a 75% improvement. But the control group, to which none of the mental health the intervention was provided, there was an 82% decrease in their mental health and all aspects related to mental health. So they were suffering from insomnia, depression, anxiety. And again, these are children who are athletes. They are at top of the wellness food chain. They are getting up early. They are being provided good nutrition. They are being provided holistic exercise, all the things in the West that we prescribe for wellness. And these are the kids who are getting that, but their mental health has been hit so hard because of the pandemic. And through partnership of Dr. Bindu Gansupala and Dr. Raj, we were able to give those modalities to those children, and the ones who did receive 72% increment, the ones who did not receive anything, 82% decline. And that is something very earth-shattering for a lot of people that we were working with, because a lot of people thought that mental health care was something isolated in cities and villages. Is so much fresh air, nature, etc., etc. But alas, the termite of mental stresses and cognitive disorders has perpetuated itself somehow to even the most rural villages in India. And I'm glad through the modalities of wheels and through the meditation protocols that we have developed, we have been able to reach out. And especially when we have partnered with the scholarship funds, we have motivated children that are now working with these modalities, and we have clinically shown how burnout and exhaustion in students, in athletes, and in rural families can be mitigated through these modalities. So I'm extremely grateful for this partnership that allows me to take our expertise to the most vulnerable parts of society. So thank you so much, Dr. Raj. Thank you, Dr. Bindu.
Thank you, Ishanji. No question that mental health plays even a greater role in physical health, and something that can be done. We have found an easy way where Ishanji has prepared a very effective video app, which will be installed on our smartphone along with our Evolco's software. The people at the village, they will be trained either online, or those who are close to the ashram in Uttar Pradesh, they actually can go there. They'll be trained, and hopefully maybe once a week or twice a week, they will conduct meditation and yoga classes in their villages. So this is the program, how we will bring mental health to the villagers. Thank you, Ishanji. And not only they provide us the video, but Ishanji has provided tremendous help. He donated more than $10,000 last month for our cause, and opened the doors for a lot more resources that we'll get in India as well as here. Next, it is my great pleasure to welcome, and I'm delighted to bring Chintu Patel. Chintu is a very successful entrepreneur in pharmaceutical, their MNIL, which is on New York Stock Exchange. worth more than $8 or $10 billion already. Done a tremendous charity work in Gujarat. As I mentioned, his two brothers, they have taken a charge of amazing philanthropy. In our Wheels Global program, one thing which was missing was medication. We didn't have that, and Chintu brings that in. So Chintu, and I also can say he would address me as Mama because my elder sister's daughter and Chintu were schoolmates in Ahmedabad. Chintu, please.
Sure, thanks. Yeah, good evening, everyone. I mean, it's amazing. Thank you. I call Rajni Mama. It's great to connect with all of you. I don't know. I just know Rajat and Dr. Shah, and many of you are new. We've been associated, like myself and my brother. We've been associated with Wheels from beginning for a long time. So just a brief background, I'm a co-CEO, co-founder of Amneal Pharmaceuticals. We are the third largest generic pharmaceutical company in US. We employ over 8,000 people and 6,000 employees are in India. Purpose of our entire business is to provide affordable access to quality medicine. That's the entire generic industry and that's what we drive. So we are a very purpose-driven organization. As you know, even in US, healthcare cost is a challenge. And that's why the generic industry, on an average, I don't know if how many you are aware, brings about 100 billion, be as a boy, $100 billion savings every year. That's the one industry where, including an inflationary time, always bring the savings. So we are very proud of the work we do and we provide access. We hired McKinsey about 2-3 months back to do a deep dive on biologics drugs because that's the new wave that is happening is in biologics. And to our surprise, 50% of biologics drugs are not even available in developing nations due to cost. So I and my brother and our entire business, our teams of over 7,000 employees, we are dedicated to work not only on the small molecule also, but now we are starting on a large molecules, including we are putting up a brand new facility for mRNA vaccine in India because that mRNA platform vaccines are not available in India. So our goal is to provide affordable quality medicine. So we have our own foundation. We have Irada Foundation, which is focused on healthcare, and we have our own mobile clinics, about 6-7, including we have one of state-of-the-art dental mobile clinic, 2 of them. And we also have an eye mobile clinic, and we also have the general medicine mobile clinic. We are equipped with doctors and medicine both on our mobile clinic. When Dr. Shah reached out to me, I haven't been associated with Wheels that much, but there's so much that in India we can do that everybody can work together and create a win-win situation. All of our goal is to provide service to millions of people who do not have access to medicine, neither the quality healthcare. So we are looking forward. I mean, in India, once we do provide, because access is a problem to healthcare, the next question is where do they get their prescription filled, right? Especially on a common medicine. If you look at 80% is all, I mean, I'm not a doctor, but either pain medications or antibiotic or for the blood pressure or diabetes drug, something that is very common. Vitamins, iron deficiency is very common. So that's where we want to work with Wheels, that how can we combine the telemedicine piece along with providing right away access to affordable medicine. So most of the time is the patient compliance and you give a prescription, we have diagnosed, but they will never get a prescription drug filled. So nothing, all the hard work that we have done goes in vain. So I think it's the key. We have many ideas, create a small, we have machines here, vending machines, or do a small kit that is available that the vans can go around and fill them up every 2 weeks. We are in healthcare. We make billions of tablets and capsules every year. We can work with other pharma guys. They can bring and we can provide some kind of affordable, medicine even below the cost. And we can work with governments. We are connected with the governments also. So I think it's a win-win. All of us can work together and looking forward to working with Wheels Foundation. And congratulations, Dr. Shah, all the work you've been doing, and good to see all of you guys. Not taking any longer time. So thank you very much for inviting me.
Thank you, Chintu. Such a amazing work that you, your brother, and I know your dad, who was ex drug quality control inspector, and he really has done an amazing job in creating this phenomenal organization. I think having telemedicine centers, which can further expand your reach, make the care available all the time instead of when van is going, but with your van services, we can start delivering the medication. So it really becomes a very complementary. And I'm so delighted that finally I could coerce you to join and come and be here. So thank you.
It was your
very much.
relentless effort. I give credit, 100% credit to you.
Okay. I'm persistent.
Yes.
Okay. Thank you so much. Next, I have Dr. Joseph Jalil. Joseph is a member of our Health Council, a Amazon bestseller book co-author with Ambassador Pradeep Kapoor on COVID pandemic. He recently addressed API convention in Hyderabad and talk on prevention. But I thought Joe can tell us about what preventive thing we can include in our telemedicine offering, which is the easiest to do, which can bring the highest bang for our bucks. Dr. Chalil, please.
Thank you so much, Dr. Shah, and good evening to all of you in the US, and good morning to everyone who is signing in from India. It's an honor. Again, I had a pleasure of chairing the 15th Global Healthcare Summit CEO Forum, which is part of the API, the Association of Physicians of Indian Origin, held in Hyderabad, India on Jan first week. Dr. Raj Shah was supposed to come and be part of our team, but unfortunately due to health reasons, he couldn't. But it was a great meeting of industry leaders. So we had prominent speakers from, with our president, Anupama Gotimukla, Professor Nalapat. We had Sangeeta Reddy from Apollo Group. We had Vikas Bhatia, director of AIMS Hyderabad. Dr. Gaurav Reddy, founder of Sunshine Hospitals. We had Jubi Nara, vice president of Sanofi Genzyme. We had Gaurav Agarwal, managing director of IITPL. Karthik Anandaraman from Roche India. Dr. Anuj Maheshwari, governor of the American College of Physicians of India chapter. Shekhar Satyaraju from Takeda. Aarti Shah, trustee of SRLC USA and former Eli Lilly executive. Dr. Niaz Mohammed, Dr. Murthy Gokula, global founder of Global Teleclinics. Dr. Venkatarama Sidigali, Excel Multispecialty Hospital. Dr. Narayana Rao Sripada, Salsit Technologies, and Ravi Gopalan of Argusoft. So again, to have a quick update of what the point is, I just shared with you on the chat room one of the op-eds we wrote along with myself and Dr. Anupama from API President at Sunday Guardian regarding the need for preventive health in India. So again, in America, it's very customary that people with insurances gets a free annual physical exam. Of course, many people may not use it, but it's an option available so we can screen patients and early detect hypertension, blood pressure, diabetes, cancers, other things. And we have a preventive task force appointed by the president, which determines what does each individual, a male or female, based on the age, should be looking for. Let's say if you are a 50-year-old male going to a doctor's office for the first time, these are the checklist which you should be screened for. And that's different for a 17-year-old male, or that might be different for a 70-year-old female. So we were proposing as part of this, one of the outcome of this meeting, the CEO Forum in India, was that we proposed to Prime Minister Narendra Modi ji to appoint an Indian preventive task force. So let me read and stop a letter we wrote to Prime Minister, an appeal by API to the government of India to initiate efforts for creating an Indian preventive task force and conduct annual preventive screenings nationwide. Dear Honorable Sri Narendra Modi ji, American Association of Indian Origin is the largest ethnic organization representing over 100,000 Indian doctors, has initiated preventive healthcare screenings in 75 Indian villages already. Again, this is somewhere Wales and API should collaborate, in my opinion, where the API's preventive screenings and Wales rural village, there should be meeting of the minds. I would say, I know we have Raj Bayani here, and other API members also will be here. We should joining us. So during the 15th annual Global Summit, we talked about this, and we urged the government of India to appoint an expert panel of nationally recognized experts in disciplines of preventive medicine, primary care, internal medicine, family medicine, geriatrics, pediatrics, behavioral health, public health, mental health, obstetrics and gynecology, and nursing to create an Indian preventive task force. And this task force should strategize and implement annual physical screenings nationwide. And we also recommend that in addition, private hospitals and insurance companies should be encouraged to provide annual physical exams or telehealth visits. Again, that's another place where what we are doing with the Wales Health Council and the Wales programs would pitch in. And following IPTF recommendations for free and affordable cost. That's where, Dr. Mr. Chintu Patel's, Amneal and other generic medications could go a long way. You don't need 50 medications to provide essential care. Most of the cost of healthcare worldwide is due to few chronic diseases like diabetes, like hypertension. These things, we can prevent and detect early and manage them. It will prevent a lot of cost to the taxpayers, especially if we can identify some cancers early on and treat them early on. It'll be great. So our recommendations are, with one of the largest rural population in the world, numbering almost 890 million, which is larger than the combined populations of the countries of North America and Europe, India could lead the world in providing quality healthcare to all its citizens. The recent COVID-19 vaccination drive is a great example of how we have done that. We believe the largest democracy in the world needs urgent investment in the preventive health of all its citizens and grassroots level reform in public healthcare system. So in a nutshell, I believe there is a long way we can collaborate between API, between Wales, Government of India, and other nonprofits to create a potential healthcare screening program for India. And I request all your support to make this happen. Again, I have seen other countries like South Korea, where the preventive screenings are mandatory once in 2 years. Again, it doesn't have to be annual or biannual, or it could be anything. At least to start, any screening is good. Whatever we can do, even if it's just, as you said, just the weight, just the diabetes, just the blood pressure, it's a good start. Any questions? I'm happy to answer.
Joe, thank you so much. Screening is one of the important part of every patient that will come through our telemedicine clinic in village. All the particularly high blood pressure, blood sugar, hemoglobin non-invasively. Some of these things we'll be doing regularly. This data, as we expand, will be available, and we can combine. And as I said, something that API wants to do, combining with Wills, we can do a phenomenal task. And when I mentioned about the goals, you will see the kind of reach that we have a vision for, which should be phenomenal. I think, thank you so much. The next thing on our ongoing project, most important, everything that we do, we need to bring together and make it an impact and outcome report. This task is undertaken at a Global Health Institution at New York University, MPH class under the leadership of Reina Bandari. Reina, you are there? Reina? I think I do not hear Reina. So I'll just mention that this is being done. Anilji was very kind to finance this, donate $10,000 to NYU. We are working on creating this project, the report. And this report, there is a very specific reason, which I'll mention when I come to funding. This report, which I've been told by our chairman, that once we have that, we can go and get funding for many, many, many more telemedicine sites. Our Evolco partner and its CEO, Amit Khare, he is helping us. Amitji, you are on. So I'll just ask you to take 30 seconds to tell us your cooperation and what you are providing us. Amitji.
Oh, thank you, Dr. Raj, for giving me some time to talk about it. I am the founder and the CEO of Silicon Valley-based Evolco Systems. We are providing the platform and the solution to provide the telemedicine in the rural parts of India, along with the other things, the CCM monitoring that we do. We collect the data in the longitudinal format to make it very easy for analysis of the data. The way we do the data analysis and the way we collect data, I'll give you a brief about it. We first take the baseline data based on the gender and the age of the patient to assess where the patient stands. And then we take, using our proprietary adaptive algorithms, to collect the HPI with history of present illness for whichever problem the patient comes on. And lastly, before the patient leaves, we do take sample questionnaires and all those things to screen for the NCD, which includes the diabetes, hypertension, and cardiovascular diseases, including cancer and cancer also. Once we have this data is then analyzed and given a report. We give the report for the doctor to create the treatment plan and give it back to the patient. It saves a lot of time for the doctor because it creates, they get a very analyzed data before speaking to the patient. And that's the advantage that we see. And we do not stop there. And we do provide the follow-up monitoring of the patient as soon as by creating a dynamic care plan for the patient. And that's what the solution is about. And it is being used in India. Thank you, Dr. Raj.
Thank you. And I'm very grateful that finally we figure out and in that getting the data to be anonymized data to the institution. I got tremendous help from Nishit Desai and Dr. Milind Antani. I just want them to welcome and have them say a word. They're coming in and joining Health Council gives a tremendous help whenever we have any regulatory or compliance issue for our nonprofit. They are there to help us. Now, Nishit Bhai, I have to say something special that we also, after talking to, found out that not only, one of the largest law firm with more than 100+ lawyers everywhere in the world. His roots also, law training, happens to be in my hometown in Mehsana. He used to come to learn from his uncle, who was a lawyer practicing with my dad in Mehsana. He then became High Court Judge, J.P. Desai. So we have a connection there. And Nishit Bhai, welcome. Just a word. We are so fortunate to have you. Please.
No, thank you, Raj, so much. I think in a billion people, we always find connect. I think that's our and somewhere along the line, we'll always figure out we are related because I think we are the same breed as human being, for a long time. So somewhere we must be connected, Anyway, very quickly, it's a delight to be part of the board. Basically, we are a law firm. We describe ourselves as India-centric global law firm. So most of the work is international. And we have offices in Silicon Valley, in New York, in Munich, in Amsterdam, in Singapore, in Bombay, Delhi, Bangalore. And we are intensely research-based law firm. Our philosophy is that every new technology, every new business model, every new social, political, economic development brings along with it a new strategic, legal, tax, or ethical issue. So typically, we look to the future next 3, 5, 10, 15 years from now. Of course, based on the premise that future may be uncertain, but is not unthinkable. And we look at and study a lot of technologies, and we are a multidisciplinary group in the firm. So you'll be talking to Dr. Miliantan in a second. So we look to the future sometime in 20 years, 25 years. But today visualize the future legal issues, future tax issues, future regulatory issues, and shape the world for the better. We spend almost 45% of our time on research, and most of our clients are also in the US, but I don't want to bore you with all the details, but it has been such a pleasure to be talking to you. And if we can add 1 cent value, others will add many dollars, millions of dollars and billions of dollars. We can add 1 cent, but anytime, most welcome. And as I mentioned that, in the US, we have offices, particularly in New York and Silicon Valley, where from we practice Indian law, but integrate that with the US and other ones. So maybe over to Milind. I have spent more than a minute, I don't know. But thank you.
That's
so much.
fantastic, Nishit Bhai. I'm so fortunate that you agreed, and I know you start very early day there, and Milind Bhai, before I let you speak, I have to tell our group that after talking to him, I found out that our alma mater is same. He's also Baroda medical graduate, ENT surgeon, and then chose the career in law. So he's a Bombay University law graduate, and he handles the healthcare law and pharmaceuticals. And he gave me the authorized regulation that yes, anonymized data can be shared without any difficulty. There is no regulation which prevents. Milind Bhai, please tell us.
Thank you, Raj Bhai. And apart from that, I think, just what Nishit Bhai mentioned, connectivity always connects. And I'm also happy to see Sodhi Saab, because I'm born and brought up in Anand, and I was an ENT surgeon for 14 years in Anand. I've known Mr. R.S. Sodhi for many, many years. And of course, Chetan Bhai, people call him CS Mujur Chaitanya. For me, it's just the Chetan Bhai, known him for many, many years. So quickly, I will just not take much time. Since everybody is talking about telemedicine and you just asked me to just talk about compliance, let me start with a fundamental dictum, which is true, that whether you love law or lawyers, or whether you hate law or lawyers, you just can't ignore them. That is the first thing, and that is where I think the compliance comes into picture. When you talk of telemedicine in India, if something really positive that has brought COVID-19 to healthcare in India is telemedicine. Because before that, I think telemedicine was slightly dicey way to consult. There are Supreme Court orders. There were some issues on medical councils that a doctor registered in one state cannot consult a patient situated in another patient. But all those things came into place by telemedicine practice guidelines being enforced. What I would like to say that there are 2 or 3 stakeholders primarily when it comes to telemedicine. One is doctors, which is HCPs, which is called registered medical practitioners. Then there are service providers, which have emerged in last 1.5 years, who provide the platform using various technologies. And third is organizations like ours who facilitate this type of services. So doctors are regulated by telemedicine practice guidelines, and they have to follow it, especially on prescription point of view. I won't go much into detail because of the time. Interesting point of telemedicine practice guidelines is that it has excluded so far the technology providers, the platform providers, and technology like AI and ML, which is being used in telemedicine platform. So companies who provide platform are not regulated by telemedicine practice guidelines. However, there is no specific law at present which is going to govern these platforms, which is going to come very soon. I'm involved with certain agencies and Niti Aayog and others which are making some amendments. These regulations are very dynamic. Another important compliance point I would like to point out is the data. Data privacy laws are at present in infancy. There is just data privacy rules which requires written informed consent to share data to third party in electronic form, but general data privacy bill is in pipeline and we should see general data privacy law soon, I am sure in 2022 for sure, which is going to impact all, of course, anonymized data, but there's going to be a critical data and a lot of other things. So these are two primarily important things which are there. But purely when a lawyer says lawyer is going to talk about liabilities, and that is where we come into picture, that we need to be very, very careful with the drafting of the contracts, because for organizations like Wheels and others and technology providers, contract is going to decide who is going to be liable. So that is what I think I just wanted to, of course, social sector and not-for-profit FCR and others. I don't want to go into that. It's a Pandora's box. But to end, I think it's a great thing that has happened to India. The telemedicine is flying off. We being lawyers to investors, we are seeing a lot of flavor for investment into telemedicine platforms by private equities and VCs. And regulation has become very dynamic. So I think a lot of positive things are happening, but I would like to end by cautioning that it says that at the end of the tunnel, always there is a light, but it can be of a coming vehicle. So walk carefully. That's what I want to say.
Thank you very much, Milind Bhai. Thank you so much. At this point, I'm running about 15 minutes late. So I'm going to sort of go very quickly to the next thing, but that is the most important, and that is the goal. I will not share the slides. The goal is 10,000 sites by year 2024. We are at 300. I want an additional 700 in 2022, another 5,000. So it will be 5,000 in 2023. And additional 5, so will be 10,000 in year 2024. All this thing is going to require funds. The funds, that is the actually fuel that engines the wheels. And when I say wheels, literally and figuratively, the wheels organization and the wheels of the engine. And for that, we have to look at different sources of funding. And the most important that I'm looking is philanthropy by entrepreneurs, philanthropy by successful business people, philanthropy by corporations. In India, we have corporate social responsibility or CSR fund. And I'm really honored to have Joseph Nixon. He's here, who has run one of the largest CSR fund of India, SBI Foundation. And he will tell us in a couple of minutes how Wills can get, how Health Council can get access to CSR funds, the secret. And he, not only he is a guru of CSR funds, but he's also a marathon runner. So I want to put Nixon ji on a marathon on a wheel so that we can have we can go much longer distance. Joseph Nixon, please.
Thank you, Dr. Raj Shah. And it's really inspiring to be amongst a group of visionaries and philanthropists. I'm really motivated by whatever I heard so far and the activities of Wheels Global. I retired from SBI Foundation in May 21, and since then I have been associated with the Children's Love Castles Trust in Bangalore. It is an NGO in the EdTech sector, which has been there for the last 25 years. And we are trying to provide access to quality education to rural government schools. And so far, we have implemented our program in more than 4,500 schools in India. And it's many of the organizations support us because it's our cost is around 1 lakh per government school. And so many philanthropies try to adopt 1 or 2 government schools by paying 1 lakh each. So that is about what I am doing now. And along with that, I'm also advising many NGOs, mentoring many NGOs on how to avail CSR funds. Coming to CSR, I find that during the last year, there has been a drop in CSR funds, mainly because of the COVID impact. But whatever CSR funds have been available, a significant portion of that has gone to health relief. And COVID has brought into the forefront 2 sectors which require a lot of support. The one is education, another is health. And last 2 years, most of the corporates have been focusing on health largely. However, the amount of funds which is flowing to the CSR sector has slowed down. Because that's also an impact of COVID only. And also, most of the corporates have donated to the PM Cares Fund. So that also results in funds NGOs finding it challenging.
In the development of economies and business. Okay.
And as regards availing funds from corporates, what I find is that if the project is innovative, if the project has a lot of impact data, and if it is sustainable, it will be attracting corporates. So innovation, how our project is different from the others in the market. Second is whether our project is sustainable after the funds have been distributed. And third is how much impact study we have conducted. What are the ways in which we measure the impact? What has been the impact of the project which we are doing, especially telemedicine? If these 3 aspects are clear in the proposal or project, it will be easy to attract CSR funds. Apart from all these, what I find is networking is very important to get CSR funds. So maybe we have to approach CSR corporates and continue listening with them, network with them, so that we are known to them and they also feel confident about dealing with us. I'll stop here, and whatever way possible, I think I will try to get involved with Wheels Global in the days to come. Earlier days, I was quite busy with retirement related issues and all. And now I am though fully engaged with the Children's Love Castings Trust in Bangalore, I can find time to assist Wheels Global. Thank you for inviting me to this event, and best wishes.
Nixon, thank you so much. We are honored to have you. I'm privileged to have you on our Health Council, and I think your connectivity and guidance will go a long way. Our program that we have instituted is unique. It has huge impact at the lowest cost. It is sustainable and creates livelihood. It has all the ingredients to be successful in getting CSR with your guidance. The next one, obviously, the CSR leads me to our chairman, Ashank Desai, chairman of our WGF India. Ashank is a very successful technocrat in India, chairman of Mastec company, philanthropist, and looking forward to Ashank's a minute to take leadership in getting to various corporations and get the CSR funds. Ashank, please address for a minute.
Thanks, Rajbhai. Before I say anything else, I just don't know from where you get all the energy. So that is one thing I have not figured out. Second one, I want to tell the audience today, I have incubated a leadership center at IIM Ahmedabad, and we invite global speakers to talk to leadership in India. And we had one Mr. Goldsmith, who is well known globally in leadership talk. And when he was talking, he mentioned there are two people he really admires for leadership. And one of them was sitting in front of us, Dr. Raj Shah. So that is his level of achievements. But coming back to CSR funds, as I said, as Mr. Nixon said, health and education are the main components of the of donations. However, it has slowed down because of all this CSR COVID issue, I mean. But what we should be doing, and I think I need Mr. Nixon's help there. I think public sector and public sector banks in particular have a large funds, and they would really like to deploy on this philanthropic objective like ours. And what we need, of course, is the project proposal, as Mr. Nixon has said. My suggestion is that if Mr. Nixon could help us to locate some of these contacts, then we can follow it up and then focus on it. The second is, of course, CSR corporates who are focused on healthcare. So that is something that we need to work out, particularly pharma companies who would be interested. But I would first start actually with public sector and see where it goes. And I think Mr. Nixon being on our committee would help a great way. So I'll stop here. We need to put the efforts now.
Thank you,
Thanks, Raj.
Ashank. Thank you so much. Thank you for your very kind words. Next, I'm going to ask Anil Bhandari. Anilji, I call him, he brings the spark that lights up the fire when it comes to funding and donations. So Anilji, he made a special, I'm so grateful, he made a special effort to be here, even though you had commitment to with the family, etc. So Anilji, please, a minute to bring your spark. Unmute your microphone, Anilji.
Dr. Saab, thank you very much. And again, the audience is amazing, and it's truly a distinct pleasure to be talking to the audience. First of all, I must say the work that you have done is truly exemplary, and the commitment you have shown is exemplary. So one of the reasons I'm going to talk about is funding. But before that, I think my daughter has been working with NYU and Wheels, and she has basically analyzed the data for telemedicine. So I'm going to let her present. As you had called her earlier, apparently she had gone to the bathroom when you called.
I see. I'm sorry.
So
okay.
I'm going to let Reina present, and then I will talk about a little bit about funding.
Thank you.
Reina, please go ahead.
Thank you. Thank you so much, Dr. Shah. Thank you, everyone, for having me here today. Just very quickly, I know Amit kind of went over this, but yes, I am working with NYU team and with Wheels, and we are collaborating to analyze some of the Valco data. So as a team, we've been working on this for about a year and a half. And previously, we have created a survey to try to implement, hopefully in our phase 2 in some of the villages, to understand the usefulness of telemedicine and the patients who are using it. But right now we're hoping to use the data that we're receiving and identify any trends that we're noticing, and identify some of the demographics of the patients who are utilizing these services. What are they coming in for their main complaints? And I feel like with that, we would better be able to create a report that's a needs assessment. So you understand the population that you're serving, and maybe if there's people with certain chronic conditions more than others, directing your efforts to try and make sure you're identifying those patients or screening for them. So we're in the phase of analyzing that right now, and hopefully we as a team can travel out to some of the sites in India and implement our survey in our next phase of design. But thank you so much, Dr. Shah, for having me here.
Thank you, Raina. Your report is going to be a key for us, and I'll mention when Rajat ji, I invite him to say a word. Anil ji, if you want to say a word.
Yes. So as Raji mentioned earlier, that the fuel for the wheels is funding. And I'm the bad guy or the good guy who basically always brings up the funding. Everybody who's on this call is all showing commitment to this particular project, telemed and the healthcare affordable access, as well as wheels. So my request to everybody is that we need to dig into our pockets, and whatever amounts that we can give, we have to give to wheels, because without the sustenance of the finances, we cannot really move forward with all these projects. So the big philanthropists, please open up their pockets and ask some of your friends or relations who are also connected to basically contribute to wheels, because we need the funding, and we need, with the funding we have the resources, and with the once mobilizing the resources we can increase our reach. And again, the people in India, I know it's hard to make a contribution, large contributions, but any contribution from you guys, let's say over a lakh of rupees, would be welcome. But again, whether it's 1,000 rupees or a lakh of rupees or 5 lakhs of rupees, whatever contribution is welcome. But please understand that we do need the funding, and if you're committed, and we want you to have the feeling that you are really giving back to the society. Thank you very much.
Anilji, thank you so much. That brings our chairman, Rajatji. Rajatji, you had told me last year, I'm getting that report. I said, let me have 10,000 patients. Now I have exceeded 13,255. The report is going to be ready. It will be in your hands before the semester at NYU ends. So please address us, your vision, your inspiration.
No, I wanted to say on this fundraising topic, having worked with the Gates Foundation for many years, the primary aim of Gates Foundation in a fundamental way is health equity and health access. That is their largest kind of priority and largest effort. They are, of course, the world's largest foundation, and I think we should make every effort to connect up with them. And it is very important that we have the study we just talked about in terms of the impact and reach and how it creates access and how it creates health equity. I think it'll be a compelling proposition to make to them. And once we get that, I would love to help in reaching out to them and making sure that we are part of their overall program in India. I would say similarly, there are many new foundations that we should reach out. US is a very philanthropic nation and a lot of philanthropic individuals. They are very committed to global equity. And this program, the Health Council-led program here in telemedicine and other things we are doing, is going to be very appealing. But we have to put together the narrative, and we have to have the access to them and present to them. And I hope that 2022 will be a year when we will take these external initiatives. And Dr. Shah, with your leadership and energy, I'm looking forward to helping you make that pitch to many institutions, which will, of course, allow us to scale up with the ambitious program that you have outlined. So I have to say that the work of the Health Council has been inspiring. Your leadership has been inspiring. And I didn't know that it was really quite possible when you started this, but I see that we are well on our way. And I really want to now step up to raise the funds that would be needed to scale up. So over to you.
Thank you so much, and I'm so confident that with all the people that we have, the connectivity that we have, and the program that we have, as you say, compelling health access, equity, providing care, getting the biggest bang for the bucks, all ingredients. I'm looking for great success under your leadership, Rajat, and all other board members. So thank you so much. The next, at this point, I think my time has kind of come to 1.5 hours. I still want to take 15 more minutes. I knew it was a daring proposition. We'll try to finish in next 15 to 20 minutes. So please stay. This is amazing energy that we have brought together. The other important area, in addition to funding, is alliance. We have to be part with other organizations which can bring in added value, which can bring in added members, which bring added donations. So for that, under the alliance, one person who has done amazing job to bring donations as well as publicity is none other than Dr. Raj Bayani. So I'm going to ask Rajbhai to say a word, please, and something that he wanted me to show. All of you have already seen that, but I'm presenting this here on his behalf. So Rajbhai, you can talk now.
Hello, everybody. I'm truly humbled and honored to be here with a group of such a distinguished entities and people. And this is truly an amazing group where it's an absolute pleasure to work with you all. And this work, which has been started by Wills Global Foundation and Health Council, is truly mind-blowing. After this news came out, actually, it has really gave us tremendous credibility because it has a wonderful write-up by Rajbhai, what exactly we're doing and how much we impacted. And that has got a lot of people curious about our work, and they are very impressed also about what we have achieved so far. And I think with this newsletter, which news came out, a lot of physicians actually want to join willingly and very enthusiastically our council. And they also want to do in their own cities and towns. I believe now we will see a tremendous momentum going forward, and we will continue to publish our work because, see, as much as all of us are very accomplished, until people know what we're doing, they will not know, and then the support can be much, much larger and impact can be much bigger with education of the people, what we are achieving, what is our vision, and what is our goal. So we will continue to work on that. I already have $5,000 commitment, which adds up to our from 315, you can say we have about 320 now. So that's wonderful news. Just within, this came out 48 hours back, and we already have 5,000 people collected. So I'm sending out to check to the Wills Global Foundation Health Council. And I am absolutely at just phone call away if anything you want me to do. I'm very happy and honored to be part of this group. Thank you, everybody.
Thank you, Rajbhai. Dr. Bayani is an ENT and plastic surgeon in New York. Amazing leader, man of action. He formed a group. He's a president of FIPA, which is aligned with Wills Global. More than 2,000 physicians. Not only he brings that group with us, but he also brings his ability to PR, getting the news out, which is going to help us tremendously. We are all aligned together, and he helped tremendously during a COVID crisis of sending oxygen concentrators. We sent more than 400 of them to India. He was always there and available. And one other thing, Rajbhai is contesting to be vice president of API and subsequently become president of API. That will give us a tremendous connection of Wills with API. And any of you, any of your friends who are members of API, please ask them to vote for Rajbhai. Thank you very much, Rajbhai. The next thing that we need, thank you very much. You are an inspiring leader. And when you publish, we had Raj Shah, Raj Gupta, and Rajat Gupta and Raj Bayani. So somebody asked me, do you really have to have Raj, triple Raj to make the things happen? I said, no, anybody can do that. Thank you so much.
Thank you.
I have other thing we have to do is alignment with physician. I have noted physician, we have 12 physicians in our health council representing about 10 medical schools. If we can have alliance with the medical school, medical alumni associations, and have their commitment to provide charity service. So I'm just going to ask, for short of time, I'm going to ask Dr. Ashok Gupta, say a minute about Nagpur Medical College and hospital, we can get them. Then Chaitanya for Baroda Medical College, and Dr. Vaidya for Bharatiya Vidyapit College. Just a request that we make an alignment and explore the possibility. Dr. Gupta, Padma Shri Dr. Ashok Gupta.
Thank you. Just two comments I want to make. Of course, alumni associations of each medical college play a very vital role. But before that, I want to just add 2 points that which Dr. Milind has mentioned. There's every medical college by regulation has got a telemedicine department, which is equally fully equipped and manned by the Government of India, and the Telemedicine Society of India and the Niti Aayog has come out with a regulation and the guideline. What sort of consent has to be done by MBBS doctor, what sort of consent has to be done by Ayush doctor, and what he said that the regulation is going to come by the end of this year, which is very, very vital point. And I think it is important for us also to be part of the Telemedicine Society of India, which is founded by Dr. Badrinath of Chennai and Dr. Saroj Mishra from Lucknow PGI. It's very, very good society to follow, I think. And
thank you.
If time permits, I would share one very good example. Recently, I was invited to attend a health camp in Bhopal. It was in a remote area, but more than 500,000, 5 lakh people were registered beforehand. Every patient detail were there. I did not have to do a physical examination of every patient. I conducted operative session sitting in that small village camp. We conducted CME program in all medical colleges across state of Madhya Pradesh and did teaching program. So state government is also looking forward for these services of telemedicine. So we should tie with the respective states also.
So I look forward to your close connection with many hospitals and particularly your alma mater, Nagpur Medical College, so we can do something. Chaitanya, colleague from my Baroda Medical College, he practices in Baroda, so he's very close to the college, and see if we can do something. Chaitanya is also a pioneer in telemedicine, very early adapter. He's also chairman of IEEE for Gujarat. So Chaitanya, you want to say a word to explore this with Baroda Medical College and Alumni Association? Chaitanya Buch.
Thank you, Dr. Raj, for giving the opportunity to be with the dignitaries. Village clinics are increasing under Dr. Shah and all of us, the team. Deeper penetration, as rightly told by everybody and mentioned about the NHRM and other things, telemedicine initiatives by the Government of India and Government of Gujarat also. I have had a talk and they also are interested in going the last mile. So doctors are always ready. Apart from college, alumni, private practicing doctor, we organize a conference of healthcare IT conference, HITCON, and we have about 3,000 doctors. And we also have to take the potential users of Telemedicine Society of India and ask all of them to participate and donate at least 1 hour a day or a week, and that will increase. The logistic can be worked out with Amit Khare, and as a starter, I have committed with you and we'll talk to Amit Bhai. So before we include 1,000 doctors to give 1,000 hours, at least for 1,000 next patients, I declare my donation of their fees from my side. So I would wish lot of success to the already increased good work that is being done all over the country. Alumni people are all over the world, whereas at India, so they can be used all over wherever they are and in the patient's language. But at India, from our associations, I will try and get apart from Telemedicine Societies of India. Thank you very much for the opportunity.
Thank you. Thank you, Chaitanya. Dr. Vaidya, you are a professor at Bharatiya Vidyapit Medical College Hospital. We'll also be doing a project together for screening for cervical cancer. If you can help us to get charitable services from physician or physician group, either medical college, hospital, or Dr. Vaidya.
Yeah, hello sir. Thank you. Thank you so much. I'm Dr. Varsha Vaidya from Bharati Vidyapit Medical College, Pune, Maharashtra. I am associated with Bharati Vidyapit Medical College for last 30 years, and ours is a A+ accredited college by NAC, and also lab is NABH accredited. I am implementing telemedicine project in Bharati Vidyapit for last 6 months. We have 250 specialists and 200 PG students working with us right now, and 11 specialists are on this panel for telemedicine. And the key finding in my project is we should have a training program to change the attitude of specialists towards telemedicine. I think that will definitely help in the increasing the participation of specialists. Thank you, sir.
Thank you so much. Thank you for, and we look forward to bringing them to provide service to us. I'm going to ask now our association with Setu Foundation with Priyaji and Nandini ji. They are running an amazing medical services in Uttar Pradesh, particularly having vans. They have formed alliance with Wheels, and I'll just let them say 30 seconds each on our plan together to take use their vans to provide in-person need, medication, etc. Priyaji and Nandini ji, and they're also amazing in raising funds. So
Raj, they had to leave early because of other commitment.
Oh, I see.
Yeah.
Oh, okay. All right. So that will be with the Setu Foundation. Thank you. Another alliance will be Rotary International. Himanshu is there. He has worked with Rotary. We will be doing some kind of association. They're international, but they are hugely popular in India. Himanshu, you want to say a word about Rotary Alliance that we can start? We did some work in Aurangabad, but we want to take it national. Himanshu Verma is also our newly elected board member.
Hi, everyone. So last year when India was hit pretty bad by COVID, we decided to collect some funds and send about 300 plus 450 oxygen concentrators to India. And I think we managed to collect about $350,000 in a very short time frame. So as part of that, we sent 10 oxygen concentrators to Rotary Aurangabad. Most of them went to IIT Delhi, but 10 did go to Rotary Aurangabad in India. And I think that did start our relationship with Rotary Club in India.
Thank you.
That's right.
And Himanshu, we look forward to...
Just stop you, Milind, here. So Himanshu, if you need any help from 3060 district, please let me know. I was a very active member there.
Oh, wonderful.
Absolutely. And by the way, my dad's been a Rotarian for 40 years in Hyderabad. He was the president of Sikandrabad Rotary Club for quite some time.
Wonderful. So we want to have an alliance so we can go starting local, but we can go national. Now I think we're not going to take more than 10 minutes. So please stay with us. Only announcement is that I think is Sundar Bhai there, Sundar Kamat?
Yes, I'm here, Raj.
Okay, just a word about Annapurna Foundation and Child Nutrition that we will be combining and appealing to Amul Foundation. I'm not sure if Dr. Sodhi is still there. He was attending wedding, but he will present to them and will get a tremendous cooperation from them. So Sundar Bhai, if you want to say a word about...
Very quickly, We are focusing in Annapurna on malnutrition and undernourishment. And India has a very high population with children and women. So this trust has been working for about 6-7 years, and now we are serving breakfast program and a nutrition powder for 500,000 children across 17 states, along with governments. And the micronutrient powder is called SciSure, which is for pregnant women and children. And this is given with milk in the morning. So the collaboration with Amul will be for the milk in Gujarat, Anand, and so on. And this has had tremendous benefit in terms of birth defects, maternal mortality rates, weight gain, and cognition for the children. So
Awesome.
I would like all to join for this as well, please. Thank you.
Sundarji, thank you so much. I think we're coming quickly. Is Dr. Kohli there? Manish Kohli? He had a commitment, but R&D project, which will be done under his leadership. Next, I'm going to move to infrastructure. Arjunji and I had a meeting. He has a commitment, so he could not attend. He very much wanted to, but I'll just tell you the gist of it. He will help in procuring hardware and helping in that way. And that will be a huge help because that's where we spend all our donation. So it will be that. Plus, he also works with Evolco and other software company, and he'll be helping from there. He asked us to focus on 3 projects that we have undertaken: Amul, Pandharpur, and Varda project, and we expand that. So that is the message from Arjunji. I have Ratan Agrawal ji. He's going to tell us he has worked tremendously to create a infrastructure of the corporation. And he's going to take a minute just to show us how that structure is shaping up. Of course, it is nothing in ironclad. It is flexible, but at least it's a blueprint where we can begin. Ratanji.
So thank you, Dr. Shah. I think I'll just take brief for 1 minute, given the we are very short of time. So one thing I will call out, so Wheels have really now set out a very aspirational goal. I think with the capacity we have today, I don't think there's any doubt we cannot get to that goal. So we are really challenging ourselves to achieve impact on 20% of rural and semi-urban population of India by 2030. And the kind of programs and kind of leadership we have just on the Health Council, I don't think that goal is really too far. So to achieve that and to help the wonderful work being done by Dr. Shah and the team, we are putting a very robust organizational structure, which will take us over to that goal in the form of our trustee board. Many of the trustees are on the call here today, as well as our board leadership team, which is providing a lot of support day in and day out. And then also this is the structure of chapters, councils, and committees. So that way we have a proper organizational setup. And every council gets proper support as they're selecting the wonderful projects and rolling them out. So collectively between our 5 councils and 4 committees, and then number of chapters across India, USA, and then now we have the latest chapter from Australia. Ravi Bhatia is on the call. So I don't think we will have any problem in terms of sustaining and providing the leadership. The last thing I will call out, I think each council will be building this really great group of impact-minded change makers and thought leaders. And we have many, many examples from today. So I think this is a great practice. And I'm sure all of our councils will be having similar representation. The other thing is these councils will leverage our ecosystem capacity, not only the IIT alumni, but medical professionals, professionals from other organizations. And then finally, I was going to call out the portfolio, but already looking at Dr. Shah 3 examples, not only the telemedicine, but mental health and pharmaceutical programs. So we have plenty of wonderful projects which will make us nice portfolio and which will allow us to bring impact at a much larger scale. So looking forward to working with you, and we already got one great start.
Thank you. Thank you, Ratanji. Very quickly, we have now last 5 minutes. I'm going to ask Hitendra to say a word, the founder and the granddad of Wheels Global Foundation as well as Penn IIT, and inspirational for what we have been able to do in Health Council. Nitenda, a word from you.
Okay, thank you. I want to touch on 3 points. One, we talked about 10,000 heart centers, which will cost $10 million, which you have to raise. And with the gathering that I see and the energy, that should be a very modest goal. So I'm counting on all of you to have that so that we have such a goal met and operating within 3 years. Secondly, we have to bring out that this process that we are talking about is a self-sustaining process. At rupees 30 to 50 rupees per service fee, it generates enough cash which you can provide some revolving loan. The second part of this process is it has a preventive process in the beginning, which is free of cost. At home test and health monitoring is a very vital part, and a lot of people emphasize that, which is a part of this process. Secondly, when the telemedicine operator and the patient decides there's an early onset of disease and needs a consulting, then only he pays a service fee between 30 to 50 rupees on average. So that is a very affordable cost. Third aspect is to how to reduce from the 110 rupees that Raj talked about to this 30 rupees level. And we think we should really tap into a very large and the largest doctors group we have in India called District Health Hospital, which is funded by the government. So therefore it becomes a public-private partnership, and they can provide the cost that he's talking about to reduce from 110 towards the 30. Second, we have an ASHA worker, again funded by the government, and the staff in the public health center who could be trained to become TMO. So these are these things I like all of you to think about creative way, how to get the panchayat government involved and make it happen to achieve our goal of 10,000 center operating and providing that like a 50 million villages access to telemedicine help and services. So
Thank
those
you.
are the 3 points I like you to everybody to carry forward.
Thank you. Thank you, Itenda. Ambassador Kapoor, a word, particularly about the Smart Village and Ideal Village program that you have, you'll be undertaking a grand scale. Please, a word about that from Ambassador Pradeep Kapoor. Most accomplished IITians, government ambassadors, civil services, a phenomenal author of an Amazon bestseller. I don't know, list is so long, Pradeepji, but I'll let you speak for the conference. Thank you.
Dr. Raja, first of all, congratulations for injecting your infectious energy across continents, across time zones.
Oh my God,
people, late in the US and early in India and everywhere in the world, Australia, etc., they are awake and they are participating in this conference because of the infectious nature of your, energy. First point. Second point, I want to say that all the best for taking the telemedicine operations to 10,000, to a scale of 10,000 and maybe even more as time passes. How you're going to do that, you'll have to probably work out a very serious map, for the road ahead. Roadmap and plans. And including cooperating with the government in terms of e-Sanjeevani or their other programs would help scale it up significantly.
Yes.
The third aspect is, I want to thank you very much for taking the name of Wheels to different corners of the world and different corners of India with your phenomenal program. Now, we are doing this Smart Village Development Framework in Aravali district, which is next to the Amul Banaskanta project. And we are, working on a holistic sort of development. I don't want to get into those details at this point of time, we are launching some more schemes now in collaboration with the IEEE. IEEE is Institution of Electronics and Electrical Engineers. Their integrated smart village, group, and along with Magan Sangralaya Samiti from Wardha, Maharashtra, where a lot of sustainability and livelihoods will be generated. Thank you for also sharing your TMO operations in Aravali through our Sevaks. We hope to make it even more intensive in the days ahead. And also one more word which I want to give to all the participants who are still left on this call, even at this hour of the night or day, is that the conference which we are organizing on Ideal Village, along with Stanford, in November, under the chairmanship of Wheels Global and the chairmanship of Stanford University and Banaras Hindu University, and participation of a large number of institutions, including IITs, where we expect the Prime Minister to participate. What I want to say to everybody still left on this call is, please block your calendars to be in Banaras at the Banaras Hindu University, November 4, 5, 6, 2022, Friday, Saturday, Sunday. It will be an exciting conference. We have a lot of policymakers from all different segments of the industry, including the health industry, who will be participating. We expect the Chief Minister of UP to come in. We expect many other luminaries from different parts of the industry, media, etc. So we look forward to seeing all of you there and contributing to that also, because the primary aim of that conference is not a conference, but to make it a movement. And to make it a movement, we will need all your support and help. So Rajat is here, the one who thought about this concept of how to make it a movement. We thank him for that. And now we are working towards that. So we look forward to your support and contribution to make rural empowerment a very strong movement in India and all over the world. Thank you, Dr. Raj Shah.
Thank you, Pradeep ji. And I now have almost coming to the closing. Just give a minute to our president, Suresh Shenoy, followed by closing remark by Chairman Rajat Gupta. Suresh, a word, you really drive the engine of the wheel. So as a president, amazing energy and amazing work that you do and inspire us all. Suresh?
Thank you very much, Dr. Shah. I am absolutely speechless by your amazing energy, your inspiring talk and determination, and your infectious magnetism that has drawn so many people to your council meeting today. That is absolutely awesome.
Thank you.
As Ratan has pointed out earlier, Wheels has embarked on a very ambitious project to impact at least 20% of our rural population by the year 2030 in the next 8 years, which is about 160 million people. And with the kind of enthusiasm that I see today, I think it is possible and should be possible sooner than that, hopefully, because the 320 TMOs have demonstrated that each telemedicine operation can impact or give access to, on average, about 3,000 people, which means we have already impacted 1.5 million people by giving them, for the most part, free access to healthcare, and in post-COVID stages, maybe for a small fee. So if we bring it up to 10,000, that's a fairly substantial number of people who will have access to such healthcare. This is a very ambitious plan. And as the old saying goes, it is not just about money, it's tan, man, aur dhan. So we are looking forward to your time, your talent, and the treasure. We need all three. So your participation today on this call is extremely encouraging. And I hope that with all the help that we have already seen from Dr. Bayani and Chintu Patel and his brother Chirag Patel, who has helped us to create the Wheels India Nishworth Foundation that has also impacted over 2 million people with potable water and significant research and development in new technologies. That is the kind of impact we want to have. That is the legacy that each one of you and us will be leaving behind. It is not how much money we made, but how much money we've been able to give back to our communities. So I'm looking forward to working side by side with you and your enthusiasm and your innovation. And thank you very much for taking the time today. Thank you, Dr. Shah.
Thank you, Suresh. Thank you for a kind word. And finally, I know later our closing remarks by our chairman, Rajat Gupta.
No, very little remains to be said, but I will just say one thing, that we are extremely fortunate that our most important resource, Dr. Raj Shah, is leading the charge in such an effective manner, and we owe him a lot for this. It is particularly exemplary because many of us know that he went through a major medical procedure, and it is great to see that you have recovered so well. It is great to see that you have undiminished energy to lead this effort into the next stage of development. We have addressed in today's 90 minutes or 2 hours or so a vast number of topics, almost covering comprehensively all the issues regarding access, regarding partnerships, regarding raising finances, impact, all of that. And all these dimensions have been led forward by many members of this group. So all I can say is, let us all give a pat on our backs, especially Dr. Shah, and let us move forward with further enthusiasm and achieve the goals that Dr. Shah laid out earlier. I look forward to working with everybody. And Dr. Shah, thanks very much for this extraordinary meeting today. And hopefully every one of us goes away with it with renewed energy to make this happen. Thanks a lot to everyone.
Thank you, Rajatji. Thank you all. And I had a quadruple bypass surgery, as Rajatji mentioned 10 weeks ago. With all your best wishes and prayers, I made an amazing recovery. I was operating on like 2-cylinder. Now my engine heart is on 8-cylinder, and I'm ready to go. So thank you all for staying. This was the meeting. I knew it was a challenge to do it in 1.5 hours. I did my best, but thank you so much for all of you being there and helping. Thank you. Thank you all.
Thank you. Thank you.
Thank you.
Dr. Raj. Thank you so much, Dr. Raj. Thank you.
Thank you, Agya, for staying.
Thank you. Bye-bye.
Bye-bye.
Thank you. Bye-bye. Bye.
Raviji, thank you.
Oh, it's amazing.
Thanks, Ravi.
Thank you. Thank you. Thank you. Indrajit, thank you. Raviji, thank you. Bindu, thank you. Milinji, thank you.
Raj, what a show.
Itenda, thank you. Kavitaji, thank you. Amitji, thank you.
Thank you, Dr. Raj. Thank you.
All right.
See you later.
Okay.
Bye.
So now we have a map, we have a path. We got to go and get it.
Absolutely. Absolutely. We'll do it. Thank you.
Kavitaji, thank you for staying so long. I kept you awake.